All right, good morning, everybody. My name's Alison, and as Kathy mentioned, my practicum project is titled Developing a Framework for a Monthly Summary Report of Toxic Drug Crisis Indicators in Island Health. And before we jump into it, I would just like to acknowledge with respect and gratitude that I completed my placement in Greater Victoria, which is located on the traditional and unceded territories of the Lekwungen-speaking peoples, known today as the Songhees and Esquimalt nations, whose relationship with the land continues to this day. Just echoing what Kathy said earlier in her opening remarks, I'd also like to encourage everybody joining online to take a moment to themselves and acknowledge the territory in which they're calling in from today. All right, so I had the opportunity to complete my practicum with the Population Health Assessment, Surveillance and Epidemiology team, or the PHASE team at Island Health. The PHASE team is made up of epidemiologists and data analysts who support Island Health's population and public health portfolio. Are we okay over there? No? Okay, no worries. Just keep going? Okay. Yeah, so they support Island Health's population public health portfolio by generating surveillance reports, conducting population health assessments, and providing epidemiological analysis across a variety of public health focus areas. And this includes communicable diseases, environmental health, perinatal conditions, and of course the toxic drug crisis, which was the main focus of my project. I'd just like to take a moment here to thank the entire PHASE team and their manager, Angela Reed, for all the guidance they gave me throughout this project and this placement, for making me feel so welcomed, and for the important work they do every single day. I'd also like to thank my supervisors, Karen Caplet and Cher Ghaffari, who are actually here today, so it's nice to see them. Especially Cher, who is the lead epidemiologist in charge of the toxic drug crisis portfolio with the PHASE team, and she acted as my main supervisor throughout the term. Cher was incredibly supportive and a truly positive influence throughout the semester, and I really appreciate all of her time, insights, and encouragement. All right, so let's jump into my project. So the PHASE team currently produces a variety of reports to inform the toxic drug crisis response, but these are all for internal use only. And while a lot of the data are available publicly, the information can be overwhelming and difficult to interpret. So partners have identified the need for a monthly report that can be shared internally as well as externally to help inform local action. So the goal of my project was to develop recommendations for this new report by engaging partners through an online survey. Following the survey, a gap analysis was conducted to identify key information gaps and priorities. And then these findings were then used to inform final recommendations for the report's content and structure. So like I mentioned, we chose to engage partners in this project through an online structured survey tool that was delivered through Checkbox Survey. The focus of the survey was to create a collaborative approach that bridges the gap between the data users and the data producers. And this had the overall aim to create a more efficient and actionable information delivery environment. The survey aimed to identify partners' information needs and provided an opportunity to assess the usefulness of existing PHASE reports as well as public data sources. The survey distribution list consisted of individuals who currently receive at least one PHASE report, as well as individuals who are known to work with toxic drug crisis data. We also decided to encourage the survey recipients to share the survey link with any additional colleagues who they believed could provide valuable insights, and this was just to broaden the range of perspectives that the survey collected. The survey was active from March 5th to March 14th, and after it closed, I analyzed the results in R and in Excel. So I'll just go over some of the key findings that the survey found, and I've highlighted a couple of the visualizations that two of the many visualizations that I created in R. So to start with, respondents were asked to rank 14 potential toxic drug crisis indicators based on their preference for inclusion in the new report. Numerical scores were assigned to each ranking, and the total scores of each respondent's rankings were then summed, and this allowed for us to display the indicators in preference, in order of preference for inclusion in the new report. So if you see on the table up there, at the top would be most preferred indicators, and then at the bottom would be the least preferred indicators. And I'd also just like to note here that all the indicators in the table you see are publicly available with the exception of the one in the red box, which is suspected opioid-related emergency department visits. And this really highlights the importance of including this specific indicator in the new report because it can't be found publicly elsewhere. And then moving over to the bar plot, this is where respondents were asked which public data sources they used most to inform their work. So going from most used to least used, we have the BC Coroner Service Unregulated Drug Deaths Dashboard, followed by the UVIC Substance Drug Checking Reports, then the BC CDC Unregulated Poisoning Emergency Dashboard, and then lastly, the BC CSU Drug Sense Dashboard. This was a really interesting finding because we want to make sure that the new report doesn't just duplicate the information that's already being used by partners, but rather complements it. Some more survey findings. So we had 28 completed responses. 40% of those were internal, meaning their organization was Island Health. 60% were external participants. We had large interest for this new report. 86% of our respondents indicated that they would like to receive the new external monthly report. The top 3 most useful data sources was the BC Coroner's Unregulated Drug Deaths Dashboard, the BC CDC Drug Poisoning Emergency Dashboard, and UVIC Substance Drug Checking Reports. 82% of respondents preferred static reports over an interactive dashboard, and clear data interpretations ranked among the highest in terms of key report aspects. So after analyzing the results of the survey, 3 gaps were identified. The first would be data interpretations within public data sources. So the survey results did show that clear data interpretations are key priorities for our partners when it comes to reports. And many of the most preferred indicators in the table I showed you a couple slides back are available publicly through dashboards, but without data interpretation. So it's possible that these public sources are not fully meeting the needs of partners in this area, which gives FAISE an opportunity to enhance data usability by providing the interpretations within the new report. The second gap would be the feasibility from open text responses. So I'll just take a moment here to note that the survey did include open text response fields to capture any additional indicators or general additions that the respondents felt would be helpful in the new report. And these did include suggestions that might not be feasible for inclusion just due to privacy concerns, such as asking for more granular data in an external facing report, or because the FAISE team just doesn't have access to the requested information. So this would be things like specific details around drug checking data. The third gap that was identified was the limited awareness of public data sources. So it was noted that a proportion of respondents were unfamiliar with some of the public data sources listed in the survey. And this highlights an opportunity to improve communication and accessibility to ensure the partners know where to find relevant data and maybe help meet some of their needs. So based on the findings of this project, I developed a couple recommendations for both the content and the structure of the new consolidated report, as well as some broader information recommendations just to improve sharing. So the first report-specific recommendation would be that it focuses on the top 4 prioritized indicators. So again, in that table I showed you, this would ensure that the most critical aspects of the toxic drug crisis are monitored without overwhelming the data user. Additionally, links to public data sources would help increase awareness of existing information and help point the new report users to public sources where they can find data on the indicators that were included in the survey's ranking question, but not specifically included in the new report. The second recommendation would be to maximize the report's value. The data should be accompanied by contextual explanations and trend analyses, ensuring that the information is not just available, but also actionable. The third recommendation would be where possible, more detailed or more granular data breakdown should be explored. Given privacy concerns around reporting on small numbers, a quarterly or less frequent release schedule could be considered for this new report, as it might help mitigate the re-identification risks while still allowing for meaningful trends to be analyzed. And then if we move beyond the report itself, it is suggested to maintain ongoing collaboration with the respondents who provided their contact information at the end of the survey, just to further refine the report's content and structure and make sure it's meeting ongoing needs. And finally, some respondents noted a lack of Indigenous data in the reports and in the survey. And while the FAISE team doesn't have access to Indigenous indicator data directly, this does present an opportunity to consult with First Nation partners regarding the inclusion of these data into the new report. And I'd just like to highlight here that this collaboration with First Nation partners should respect their authority and their inherent rights over how their data is used, reported on, and collected. And with that, I'd like to thank everybody for listening to my presentation. I'd also like to thank Dr. Margaret Skea for just her support throughout the entire semester.